12 rules for massaging away knots, muscle strains, or tendonitis. Never massage a pulse. If there's some arteries near the surface, like you want to go along the carotid artery here, you want to massage that, especially when you're using a tool. I mean, because you can really leverage it then. Number two is use a tool whenever possible, because you're going to save your hands. I don't know how massage therapists do it, Brad. I really don't.
Well,
because
I think a lot of them must use tools.
I think they do in their elbows and stuff like that. But
Right.
some of the tools are like the Theracane or a cane like this, a massage cane. You can use the lacrosse ball. Brad and I kind of like this little spiky ball.
Plus, it lights up.
Yeah, how fun is that?
Yeah, they're cheap too.
The massage guns, we got a whole variety of them. They work really quite well because they percuss at the same time you can pressure on and you don't become tired. Whenever possible, you're supposed to use deep stroking. So get deep down in if you're going to try to get rid of that knot.
And that's why you don't want to go over a pulse. You want to go over muscle, belly. Bob mentioned the pulse here. Maybe, obviously in the wrist there's a pulse.
You're supposed to do deep strokes, but you're supposed to do repeated short strokes. So you're kind of staying in the area of the knot. So if there's a knot right here and I'm massaging it, I'm not going across like this. I'm staying right on the knot, deep, and I'm doing short strokes. Also, the next one is actually in the same direction. You want to go. You don't want to go this way, this way. They just say ergonomically. I'm not sure the reason for that, Brad, but you're supposed to stay in the same direction. The pain should be a good pain. You don't want to have, if on a scale of 1 to 10, you're getting over a 5, that's probably too much. But you know how it is when something feels like it hurts so good. They are recommending 10 to 12 strokes per knot. And so that's not that many. But then you're supposed to do it throughout the day 3 to 6 times.
Okay.
So you're going to have your tools ready for, carry them with you. Let's see. If there's no relief, that's the final rule, you're probably on the wrong spot.
Sure.
That's what they're saying. So, but otherwise, if you do it 3 to 6 times a day and it's feeling like if you're following the rules like we say, hopefully that knot is going to get better. So now, what if you are having trouble with like a muscle strain or tendonitis? In that case, we're going to do more like cross fiber friction massage. If you're, let's say, on a muscle belly or on a tendon, it's really kind of the same thing. I want you to you can put your fingers side by side or one finger right on top of each other, and you're going to find the tender spot, and you go across the fibers. The fibers run this way, but you're going to go across the fibers, whether it's a tendon or whether it's a muscle. So you try for 30 to 60 seconds, and if the pain just keeps getting worse, it's too tender to begin this. So if it does plateau, gets numb, or gets better, you can keep going. Kind of as a general rule of thumb, if the pain is spreading out, it's getting worse. If it's concentrating and getting more
one spot,
centralization, Mackenzie calls it, it's getting better.
I'm going to go sideways because the fibers of the tendon go vertical in this point, and we're just going to work it this way. And, you can vary the angle a little bit. And
the thing about this, why a massage gun is good for this, because James Syriax, if you follow his recommendations, for many of these things, he recommends 15 to 20 minutes of massage. Now, we tell people to break it up, throughout the day.